Hello and welcome back to the show. Today with us we have the lovely Rowena Gledhill, and Rowena is going to speak to us a little bit about reflexology. She's professionally trained and an insured reflexologist, running her private clinic from a secluded, tranquil cabin in her garden in Dorset. And she set up Weymouth Bay Reflexology in 2016, shortly after graduating with a level 3 VTCT qualification in reflexology. And I think we're just going to speak a little bit about what you do, Rowena, and a bit about yourself, and really just, tell the listeners a little bit more. So firstly, welcome to the show.
Oh, thanks for having me, Jess. It's a pleasure to be here.
It's wonderful having you on. And I guess we'd love to first start knowing a little bit more about yourself, your background, and a little bit about reflexology and how it works, perhaps in more simple terms for the listeners.
As you said in your introduction, I'm a qualified reflexologist, and that is something that I do like to make a point about, because unfortunately in this country, reflexology is actually an unregulated therapy. So that means that you could read a book and then say, now I'm a reflexologist, because there aren't any there are standards within professional organizations, but there aren't any like national standards. Like for a doctor, you've got to have a recognized qualification. So if people are looking for reflexologists, the first thing I say is find somebody that's actually qualified and registered with a professional association, because you have to have had a minimum level of training. So for me, the minimum level of training was 100 hours of practical assessments and anatomy and physiology qualification as well. So you have to have a basic understanding of how the body works, so that when you're giving therapies, you understand what you're actually working on. And I think that's really important. A lot of people say to me, and I've had clients come to me and say, "Oh, I've had reflexology before," and then they go away and go, "Wow, that was completely different." I'm like, what happened? Where did you have your reflexology before? And like, well, I don't know that they had the same qualifications as you. And I'm like, it's quite important. My first question to everybody is, if you're looking for reflexology, find someone that's qualified. There are several professional associations in the UK. The Association of Reflexologists is the biggest one. There's Professional Reflexology, and I think there's British Reflexology Association. So they all have common standard levels, so you can get a good quality treatment from somebody that knows what they're doing.
Oh, that's definitely really important, and obviously a lot more difficult than just simply reading a book. So I think, that's really important for listeners to know. And for those that maybe are not familiar with what reflexology actually is, could you kind of whiz us through what it is? And
So the standard explanation for reflexology, that it's a touch therapy which involves applying pressure to specific areas it's usually the feet where people have reflexology, but it can be the hands, ears, or face as well. And the places that we're touching are known as reflex points, which correspond to different organs, systems, and glands of the body. And the idea is that stimulating those reflex points helps to promote relaxation, improve circulation, and encourages a natural response in your body to encourage it to heal. And it's also important to say that it can be a very relaxing and very non-medical way to receive treatments that can help you feel better in yourself.
Oh, that's a really succinct answer. I think that's really interesting, and I think definitely so much more that you could delve into that. So with kind of the clients that you've worked with, how have you kind of used reflexology to benefit individuals for different symptoms such as relaxation, so mood, sleep, well-being, etc.? So how do you kind of work with clients in your reflexology practice?
Well, the idea when people come to me for reflexology is that we're not treating a specific condition, we're treating the person as a whole. This is why reflexology is called a holistic therapy, because we look at all of the circumstances around somebody's reasons for being in my studio to have a treatment, and they might come and say, I've got a bad back, which is very common. Lots of people come and see me with bad backs. But the difference between having a reflexology treatment and going to see the doctor for a bad back is the doctor will commonly say, oh, you probably need to do some exercises and maybe take some painkillers, and they won't investigate why have you got the bad back. In reflexology, we're always asking why have you got this bad back? So things like, are you sitting properly in your chairs at home? That's a really simple one. Are you moving around enough? Do you have some pre-existing conditions that are causing this bad back? What are the symptoms? And we always work around what we feel in the feet. If for me, it's mostly feet. So what are the sensations in that person's body? What are they feeling? And how can we break the pain cycle? Because a lot of people are constantly in pain. So with reflexology, we're using the reflexology to just give the body a chance to say, stop, take a breather, relax, possibly the tension within the body, because a lot of time when you're in pain, your body is in tension. And you can, with the reflexology, help to encourage the body to relax. And that enables the body then to allow some healing, because when you're in a pain response, your body's not capable of, you can do one thing or the other. It can be healing or it can be in pain. Can't be doing both. So we're giving the body space and time to actually move from that pain state to a relaxed state. And quite often people come and they'll have a sleep on the couch for an hour whilst I'm doing the reflexology. And then they'll say, oh, I wasn't expecting to have a sleep. But that's because we've allowed the body to have that release of tension. And then quite often we'll go on and find that, you know, the relaxation and that release of tension has enabled somebody to have perhaps a better night's sleep, which means that they're getting more healing time at night, because we heal a lot when we're sleeping, and it has a cumulative effect. So I do have to be very careful about what I can say about reflexology, because it's an unregulated therapy. The Advertising Standards Agency only let us say certain things about reflexology, although within my clinic experience, I know it has other benefits. But we are only allowed to say that reflexology releases tension, that it promotes relaxation, it can improve mood, which is a very significant one for a lot of people. It can aid sleep and helps your overall sense of well-being. Those are the only claims that we're allowed to make. But as I say, within clinic, the people that I'm working with, particularly in fertility and pregnancy, and then further on into menopause, are seeing significant benefits from having reflexology treatments.
Yeah, definitely. And I think you kind of put it really nicely there, because it kind of works as a gateway into accessing better health and better quality of life even, and well-being. So I think we know the benefits of improved mood, better sleep, being more relaxed, having tension release. We know that they have benefits for things like fertility, menopause, etc. So I think kind of connecting the dots and having it as a holistic, looking at everything as a whole, I think is really important, and something that I think reflexology can definitely provide better access to.
Yeah, I think it fills a gap a lot of the time as well between conventional medicine, you know, because doctors are under so much pressure. They have such a little bit of time to have with you. If you go and see your GP, you're quite often restricted to maybe 10 minutes. My clients are usually here with me for an hour. So we have a lot of time to talk. And I think quite a lot of the therapeutic benefits of just talking about a situation that you're in addition to having that relaxation therapy, can just really bridge the gap between somebody being heard and feeling like they're actually getting somewhere. And also I am, because of my training, I am a signposter. So a doctor may not always know where next to send you. And particularly for my fertility clients, I've got a whole range of places where if it's not just me working for you, there's lots of other people that can help you. You know, you might need additional testing for something. I've got a whole range of places that I can send people for tests if they need more testing. Quite often that's a big place to start, and the GP might be reluctant to send people for tests. And that can really help inform. And I'm always trying to help my clients know as much as they can about what's going on for them, what's happening in your body, what do you need to do to support it, where do you go for extra help. And I think that a lot of qualified reflexologists often provide that bridge for their clients.
UK Health Radio, the station that makes you feel good. UK Health Radio, the station that makes you feel good.
Yeah, definitely. I think, as you said, where you get that hour to have that therapeutic time together, I think that's really important, where people can have a bit of self-reflection and really look at their health and look at what they can change, as opposed to, as you say, 10 minutes with the doctor, where people always want just a quick fix solution. But I think that what you provide is that holistic care where you can make changes in your day-to-day life, where actually a lot more sustainable and a lot more long-standing.
Yeah, and long-term change is often what we're working with clients. Most of the people that come to see me have what are chronic issues, so something that's been going on for a long time, and particularly like infertility, is it's often a chronic issue. You can't fix it in 10 minutes. You can't just have a tablet and everything be better. Something that's taken a long time to sort of appear in your life is going to take time to fix. But, fortunately with bodies, they do repair themselves quite quickly. And if we can get somebody into a place where they're doing all the things that can support their body, then you can see changes very rapidly.
Yeah, definitely. And as agreed, I think, there's far too much of a focus nowadays on, quick pill will fix everything and all my ailments will be cured. But I think, that's really important. And you kind of mentioned that you work with a lot of like female clients with regards to fertility, etc. I'd love to hear if you have, say, any examples where reflexology has made a positive impact on individuals navigating these or experiencing particular women's health related symptoms. Just for listeners.
I've been working. I work with lots of women. Obviously, they're my main client base. But quite a lot of the people that I see have problems with their cycles, and they may not necessarily be wanting to try and get pregnant, but their cycle issues are causing issues throughout the rest of their lives. If you don't have a well-balanced menstrual cycle, it can really stuff up how you experience your life. And I have one client particularly that comes to mind who has PCOS, which is polycystic ovarian syndrome. And it's very common. I think something like 20% of women may have PCOS, whether it's diagnosed or not. So it's really, really common in the population. And they experience very long cycles, very irregular as well, which is quite common, with really horrific PMS symptoms, like, really bad sore boobs, rage, complete inability to manage their hunger around the period as well. And they've been working with me. They come every month, so that's really important. They come every month, and they've been working with me for about a year. And we've now seen changes to the cycles. So the cycles now regular. So for somebody with PCOS, you can experience cycles that might be 3, 4, 5 months long. So that's a really long time between bleeds. And they're now down to 32 days regularly. There's absolutely no PMS. There's no sore boobs, and they've lost 2 stone without doing anything else. There's no management of food whatsoever, but getting their cycle back into balance has had absolutely amazing effects. So for them, because weight's often a problem with PCOS, for them, they're actually looking after their long-term health. They've lost 2 stone. And that's a significant amount of excess weight, which means that there are positive benefits for things like cardiovascular health and risk of stroke in the future, because those are a lot higher for women with PCOS. And they're absolutely amazed at the difference with they've made no other changes, just with the reflexology that they've been having, which is focused around balancing their cycle. And then obviously my other success stories, really, well, I call them success stories. They're success stories for my clients. They're people that have come to me desperately trying to have babies, and I have supported 4 families now. We have 5 reflexology babies from people coming to see me and have regular treatments supporting their cycles. So some of them were with unexplained infertility, which usually means the doctors haven't actually looked into the full factors surrounding their lifestyles or their cycles. And we've worked on those. And one of the families that I worked with were with a frozen egg transfer, so an IVF cycle, which was successful. And that lady's actually gone on to have twins with her frozen cycle. So that's amazing. So there are 5 babies in the world, which I consider my biggest successes, and for my clients,
Yeah, definitely. And I think, what you do is really good in the sense that you kind of empower these individuals with knowledge and that self-care element and those techniques that they can start to employ in their lives to kind of really, take back control of their health and really start to address their concerns that they may have. How do you kind of help these individuals beyond the reflexology clinic, say, with that and empower them with this knowledge, etc., to play a role to put them on their healthcare journey?
A lot of the stuff that I do with my clients is basic education. So many people come to me and they say, well, my periods, my cycles are like this, but and that's how it's always been for me. And when we take a deeper dive into it, nobody, in my experience, knows what should a normal menstrual cycle be like? What does it look like? So a lot of the time I'm working with them to say, right, at this stage of your cycle, this is what should be happening in your body. And then the reflexology we do works with their bodies at that time in their cycle to help whatever the function of that part of the cycle is supposed to be. So if it's during the bleed, is it a good bleed? You can tell so much about your cycle from what your bleed's like. And remembering that a bleed is actually a report from 3 months ago is also mind-blowing for a lot of people. You're like, well, what do you mean? Like, well, actually, what was happening 3 months ago in your life has an influence on the bleed that you have this month, because it takes that long for an egg to become fully mature. And that's another part of the understanding. Is always layers of lack of education that we have about body literacy. So I'm often starting from the beginning. From what I know, a lot of sex education in school is based around not getting pregnant, and that's it. And maybe some about menstrual bleeding, but there isn't anything, as far as I can see, or that I know from my own experience with clients. There's nothing about body literacy, about why you need to have bleeds, what a whole menstrual cycle should look like, not just the bleed. What is the function of it? How does it support your long-term health and well-being? Because women need to have good cycles in order to function as human beings. We're very different from men in that. We need to have a really good cycle in order to be a functional human being, and that it has an effect on your life forever, your whole life. It's not just about when you're coming into puberty and starting to bleed. It's not just about when you're being fertile and looking to have babies, if you want to do that, or about menopause later on in life and perimenopause. It is about your long-term health and well-being, and it's a huge part. I mean, it's not something that I can fix myself, but it's something that we work a lot on, is education. Understanding like how you're supposed to function and what you can do to support that in your life. So I quite often give my clients reflexology homework. So you can do reflexology on your hands to support you, again, for cycle health. If I work with males, they get the same. They can support their health with hand reflexology as well in between sessions. But I see fewer blokes in clinic. It's mostly the ladies that come to see me.
UK Health Radio, the station that makes you feel good. station that makes you feel good.
No, that's really interesting. I think, yeah, listeners will be so interested in the fact that, yeah, really providing that education beyond your what you do one-to-one, I think is so interesting. And would there be any place where you would recommend, say, listeners to, or even perhaps like a hand technique or something that you think listeners would, yeah, find useful?
There are resources out there, but I would say, find somebody that you vibe with, particularly on social media. It's a really easy place to engage. There are a lot of reflexologists who are providing information and just like snapshot techniques of things that you can do to help yourself. So that's the way that I use social media, as I aim to educate people. I'm a little bit chary about giving out general advice about reflexology because it's very person specific. But I do have on my website, there is a guide that you can access, which you can just get it's a basic guide where you can learn a few simple tips to do some hand reflexology at home to just help with stress and general well-being.
And yeah, all your socials will be tagged below. So I'm sure many people will be having a look at that after listening to this. But yeah, I think that's really empowering in filling that knowledge gap, particularly about women's health, as you kind of mentioned. How else do you kind of, help to perhaps fill that gap?
In educating people.
Yes. How do you kind of like integrate that into your work?
Well, I mean, I usually work one-to-one with people, so it's almost always on a one-to-one basis. But I do, I have also just this last month, I've run a workshop on perimenopause, because it's another area where people are poorly educated, and often. I mean, even with fertility, people sometimes are a little bit more open about talking about it. Perimenopause can be even more difficult because you're experiencing very similar symptoms to being a teenager in puberty, but you're kind of doing it backwards. It's not widely, I mean, it's more spoken about now. I think in the last year or so, I've seen a lot more content and social programs, information in the news about perimenopause. But I ran a workshop for people that wanted to know more about perimenopause. And it was literally just telling people these are the kinds of things that you might experience in perimenopause. This isn't unusual, put your hands up if this has happened. All the hands are up. And we made some products, because I was working with a colleague who actually is a product making person. So we made some products suitable for people in perimenopause that they could then use to do some hand and face reflexology. So we then, in the space of that workshop, we did some education, we learned some reflexology, and I think everybody was very pleased about that. And what was really nice was that they said, we've learned so much, we can go and talk to our friends about this. So that's how you get the information out. You tell a small group of people and they pass it on. And I think that's that's
amazing. I think, the fact that you're really working to empower people with knowledge is really important. I think also just listening to people, I think, is such a key element of it. Seems that you provide for all your clients, where it's that one-on-one space where you actually listen to their own concerns and their own issues is really, really important.
Yeah, and I actually love listening to people's stories. I feel it's a gift, that people will actually want to talk to me about stuff that's often quite personal and private. You don't really want to go around talking to people about your sex life or what in terms of fertility. You might be asking quite a lot of personal questions, and I'm always very I feel like it's a gift that people are prepared to share that information with me, because it will help them down the line in potentially becoming pregnant or managing symptoms of perimenopause, or just getting on top of their cycles, and knowing that somebody's trusting me with that information and is willing to work with me to try and empower themselves is really good.
No, I think I think that's really amazing. And I think, a really great pathway to try and, to be doing with your day-to-day life. I think that's, super amazing. And that kind of brings us towards the end of our questions. And I just wanted to, obviously all your socials will be tagged below, but is there anything else that you kind of wanted to say to listeners with regards to reflexology? I mean, it's such an interesting field, and I'm sure there'll be so much more done on it, researched about it in the coming years. So I think, yeah, it's super great to have you on the show. But yeah, anything you wanted to say to the listeners?
Well, I'd just like some more people to try it, actually, because even now, it's more recognized, but I'm still encountering people that say, I've never heard of reflexology. I don't know what it's for. What does it do for you? And I just really encourage people to sort of investigate it. Think of it as another complementary therapy like osteopathy or acupuncture. It's as effective, doesn't involve needles or being undressed. You can have a reflexology treatment just to your feet. You just need to take your socks off. And just sort of explore a little bit more about these other therapies, particularly that can support you in a holistic way. I think they can be very valuable. I use them myself, and I just feel that more people should know about them, and maybe if you don't know a reflexologist, go and ask, ask Google about the Association of Reflexologists in the UK, or whichever the professional association is in what countries you're listening to this in. Find somebody that's qualified in an area that you need support in, and just have a chat with them. Most reflexologists I know are very happy to talk to you without giving you any treatment, just to say, so you can meet them. And I think a lot of the relationships that I build with my clients are because we vibe together. And that's another important thing, is find a therapist that works for you.
Yeah, no, I couldn't agree more. I think, yeah, that holistic approach, I think it's not just doing one thing, it's adding in the diet, the lifestyle, the exercise, what works for you. If you need different therapies, I think all that holistic approach which you promote so much is definitely the way forward to not just resolving particular health concerns, but also preventing future ones. And I couldn't agree more.
Yeah, I think long-term health is a goal that we should all be looking at, and reflexology is a way of helping you to support that in your life.
I think that brings it to an end really nicely. And thank you so much for coming on and explaining a little bit more, and hopefully we can spread the word about the benefits of reflexology as well, or even just educate a few of our listeners.
Thank you very much for having me. I really enjoyed it.